Welcome to our comprehensive session on common nutrition and related health problems. Today, we'll explore the many faces of malnutrition, from undernutrition to micronutrient deficiencies and the growing challenge of nutrition-related non-communicable diseases. We'll also discuss how nutrition interacts with infections, including HIV, and examine the functional and economic consequences of adult malnutrition. By the end of this video, you'll have a clear understanding of why nutrition is central to both individual well-being and national development. Let's begin by defining what nutrition-related health problems are and why they matter globally and in Ethiopia. Nutrition-related health problems arise when there is a deficiency, excess, or imbalance in nutrient intake. These issues don't occur in isolation. They interact with biological, social, and environmental factors, leading to adverse health outcomes. For example, a lack of essential nutrients can weaken the immune system, while excesses can contribute to chronic diseases. Understanding this interplay is crucial for addressing the root causes of malnutrition and designing effective interventions. Next, let's look at the global and Ethiopian context to see how these problems manifest in different settings. Globally, low- and middle-income countries face a triple burden of malnutrition, undernutrition, micronutrient deficiencies, and the rise of overweight, obesity, and diet-related non-communicable diseases. Ethiopia, in particular, is grappling with persistent undernutrition, high rates of micronutrient deficiencies, and a rapid nutrition transition in urban areas. This means that while some people struggle to get enough food, others are increasingly exposed to unhealthy, processed diets. These overlapping challenges require tailored strategies to improve health outcomes across all population groups. Malnutrition is a broad term that refers to deficiencies, excesses, or imbalances in energy, macronutrients, or micronutrients. It's not just about not getting enough food. Malnutrition can also mean getting too much of the wrong kinds of food or lacking specific vitamins and minerals. This can lead to a range of health problems, from stunted growth in children to increased risk of chronic diseases in adults. Understanding the different forms of malnutrition is the first step toward effective prevention and treatment. Malnutrition can be classified in several ways. The most common forms include wasting, which is rapid weight loss or failure to gain weight, stunting, which is impaired growth and development in children, and underweight, which is low weight for age. There's also micronutrient malnutrition, often called hidden hunger, where people may appear healthy but lack essential vitamins and minerals. On the other end of the spectrum, overnutrition leads to overweight and obesity, bringing its own set of health risks. Micronutrient malnutrition, often referred to as hidden hunger, occurs when people don't get enough essential vitamins and minerals, even if they have enough calories. This form of malnutrition can go unnoticed for years, but has serious consequences for growth, immunity, and cognitive development. Common deficiencies include iron, iodine, vitamin A, and zinc. Addressing hidden hunger requires more than just providing enough food. It's about ensuring a diverse and nutrient-rich diet for all. Overnutrition is the flip side of the malnutrition coin. It involves consuming too many calories, often from foods high in fat, sugar, and salt. Overnutrition leads to overweight and obesity, which are major risk factors for non-communicable diseases like diabetes, heart disease, and certain cancers. As urbanization increases and traditional diets are replaced by processed foods, overnutrition is becoming a growing concern, especially in rapidly developing countries. Causes of malnutrition are complex and multi-layered. According to the UNICEF framework, immediate causes include inadequate dietary intake and disease. Underlying causes involve food insecurity, poor care practices, and unhealthy environments. At the most basic level, poverty and social or political structures play a significant role. Addressing malnutrition requires interventions at all these levels, from improving food access to tackling poverty and inequality. Protein-energy malnutrition, or PEM, is a spectrum of disorders caused by inadequate intake of energy and protein. It's especially common in children and can lead to severe health problems if not addressed. PEM reflects chronic poverty and food insecurity and is a major cause of under-5 mortality worldwide. It's also closely linked to infections, creating a vicious cycle that's hard to break without comprehensive interventions. There are two main types of protein-energy malnutrition: marasmus and kwashiorkor. Marasmus is characterized by severe wasting, with significant loss of fat and muscle, resulting in a skin and bones appearance. Kwashiorkor, on the other hand, presents with edema, fatty liver, and changes in skin and hair. Both conditions are life-threatening and require urgent medical attention, but their underlying causes and clinical features differ. Protein-energy malnutrition is a major public health concern, especially in low-income countries. It's a leading cause of death among children under 5 and is strongly associated with infections such as diarrhea and pneumonia. PEM is also a reflection of chronic poverty and food insecurity, making it a key indicator of a community's overall health and well-being. Addressing PEM requires coordinated efforts across health, agriculture, and social sectors. Effective management and prevention of protein-energy malnutrition involves several strategies. Community-based management of acute malnutrition, CMAM, brings treatment closer to those in need. Improving infant and young child feeding practices, along with food security interventions, are also crucial. Prevention is always better than cure, and empowering communities with knowledge and resources is key to breaking the cycle of malnutrition. Micronutrient deficiencies, though often subclinical, have major public health impacts. They affect growth, immunity, and cognitive development, especially in children and pregnant women. Common deficiencies include iron, vitamin A, iodine, and zinc. These deficiencies may not always be visible, but their effects can be long-lasting and severe, making early detection and intervention essential. Iron deficiency anemia is one of the most widespread nutritional problems globally. It's caused by poor dietary intake, low bioavailability of iron, parasitic infections, and increased requirements during pregnancy. The consequences are serious: fatigue, reduced productivity, and increased maternal and perinatal mortality. Addressing iron deficiency requires a combination of dietary improvements, supplementation, and infection control. Vitamin A deficiency is a leading cause of preventable blindness in children and increases the risk of severe infections and childhood mortality. It's most common in areas where diets lack animal products and colorful fruits and vegetables. Supplementation programs and dietary diversification are effective strategies to combat this deficiency and protect vulnerable populations. Iodine deficiency leads to a range of disorders, including goiter, mental retardation, and reduced IQ. It's a major public health issue in regions where soil and water are low in iodine. Universal salt iodization has been a successful strategy in many countries, but gaps remain. Ensuring adequate iodine intake is essential for healthy brain development, especially in children. Zinc deficiency impairs growth, weakens the immune system, and increases the risk of diarrhea, especially in young children. Like other micronutrient deficiencies, it often goes unnoticed but can have serious consequences. Strategies to address zinc deficiency include supplementation, food fortification, and promoting diets rich in animal products, legumes, and whole grains. Combating micronutrient deficiencies requires a multi-pronged approach: supplementation, food fortification, dietary diversification, and infection control. Each strategy plays a role in ensuring that populations receive the essential vitamins and minerals they need for optimal health. Public health programs must be tailored to local needs and resources to be effective. Non-communicable diseases, NCDs, linked to nutrition include cardiovascular diseases, diabetes, and certain cancers. These conditions are on the rise globally, driven by changes in diet and lifestyle. Addressing NCDs requires a shift in focus from treating illness to promoting healthy eating and active living, starting from an early age. The nutrition transition refers to the shift from traditional diets, rich in whole grains and vegetables, to processed foods high in fat, sugar, and salt. This transition is often accompanied by reduced physical activity, leading to a rise in overweight, obesity, and related diseases. Urbanization and economic development are key drivers of this trend, making public health interventions more important than ever. Several dietary risk factors contribute to the rise of non-communicable diseases. These include excess energy intake, high consumption of saturated and trans fats, low intake of fruits and vegetables, and high salt consumption. Public health strategies must focus on promoting balanced diets and reducing the intake of unhealthy foods to curb the growing burden of NCDs. To tackle nutrition-related non-communicable diseases, public health strategies include developing dietary guidelines, implementing fiscal policies like taxation on unhealthy foods, food labeling, and behavior change communication. These interventions aim to create supportive environments that make healthy choices easier for everyone. Emerging research highlights the relationship between diet, gut microbiota, obesity, and non-communicable diseases. The gut microbiota influences how our bodies process food and can drive the development of obesity and metabolic disorders. Understanding this connection opens new avenues for therapeutic strategies, such as restoring microbial balance through diet and lifestyle changes. Nutrition and infection are closely linked in a bidirectional relationship. Malnutrition weakens the immune system, making individuals more susceptible to infections. In turn, infections can worsen nutritional status by increasing nutrient needs and reducing absorption. This cycle is particularly concerning in populations affected by HIV/AIDS and other chronic infections. People living with HIV have increased energy and nutrient needs due to malabsorption and frequent opportunistic infections. Nutrition support is a vital part of HIV care, helping to maintain strength, support immune function, and improve quality of life. Integrated nutrition and health services are essential for managing the complex needs of this population. Integrating nutrition support into health services is crucial for populations affected by chronic infections like HIV. This approach not only improves individual health outcomes, but also strengthens community resilience. Public health programs must prioritize nutrition as a core component of infection management and prevention. Adult malnutrition has significant functional consequences, including reduced work capacity, persistent fatigue, and increased susceptibility to illness. These effects not only impact individuals, but also have broader implications for families and communities, especially in labor-intensive sectors where physical strength is essential. Malnutrition leads to lost productivity, increased healthcare costs, and reduced national GDP. In countries like Ethiopia, where many people rely on physical labor, the economic impact of malnutrition is particularly severe. Investing in nutrition is not just a health issue, it's an economic imperative for national development. Ethiopia faces a high prevalence of adult undernutrition, particularly in vulnerable populations. This has a direct impact on labor-intensive sectors such as agriculture and construction. Addressing malnutrition in these groups is essential for improving both health and economic outcomes at the national level. Wrap up, remember that malnutrition exists in multiple forms, and undernutrition and non-communicable diseases often coexist. Micronutrient deficiencies can have long-term consequences, and nutrition is closely linked with infection. Addressing malnutrition is central to both individual health and national development. By understanding the causes, consequences, and solutions, we can work together to build healthier communities.